The reason the committee is hearing this is because there are overlapping concerns and overlapping agencies, overlapping sectors that are affected by all of this. There is SDG number 3. The two main would be SDG number 3 on good health and well-being and SDG 8 on decent work and economic growth. But offhand, SDG 11 on sustainable cities and communities is very much affected. How can your community be sustainable if there is no access to health workers, di ba? So, dun pa lang sa tatlong yon, covered na yan. And of course, with the advocacy I've had since I became a senator, gender equality is also affected because you know very well, from the time of pregnancy pa lang to birth, affected na ang life ng nanay if she doesn't have decent maternity care, and then even the life of her newborn infant or not even the unborn is already affected without the proper prenatal checkup. So, marami talagang issues ang overlapping dito, and that is why we want to make sure that we cover all. They're all interrelated. So, I will not repeat what has already been established and discussed in the previous hearing. We still had resource persons available virtually na hindi na natin natawag. So that is why we will prioritize them because they were already present last time. And then we will have other resource persons. I will just call in acknowledgement as I call their name later on. My request always is huwag niyo na akong basahan ng position paper niyo because I can use my time better wisely if I read it later on my own personal time. What I would like you to do is highlight whatever it is in your position paper that you want to draw my attention to and for the record. Pero yung mahabang mga position paper, trust that we will go through it, we will read it because after this we will either have another hearing or a TWG or small group meetings because our objective is really to find solutions that we can recommend to the executive. So other than that, I believe in health and mobility break. So anyone is welcome to stand up, to move around. That is welcome anytime as long as hindi kayo yung nagsasalita. I will not say why are you standing up. That is welcome. We are also trying to be sustainable, so no PET bottles. Please ask the page na lang if you want more water and whatever. So, on that note, on WebEx, please mute your mic unless you are called. Okay. And there's also a raise hand function that you can use. All right, so we will be able to start now. And our first resource person, the first resource person for today is Dr. Tony Dance. Has been a regular resource person for many years in health hearings, in syntax hearings, and not also new to sustainable development. Our Suke, who we are on borrowed time because I understand he has clinic today now as we speak. But I promise that he will be the first, and I'm giving you the floor now, Tony, and then although I tend to save my questions for later, because you're only joining us for a short while, kung may questions, comments, I will entertain them or I will make my comments right away. And after Dr. Tony Dance, Dr. Marilyn Lorenzo. So, Dr. Tony, you have the floor.
Thank you, Senator Pia. Good afternoon, everyone. I'd like to start. I prepared a 5-minute presentation because I was told that's how much we had. I'm going to start with a shout out for all our frontline workers. Kasi, what makes us, I think, unique in the world is a singular trait, which is our ability to care for others. That's why if you look at workforce, we export teachers, nannies, entertainers, doctors, nurses, midwives. If it involves taking care of someone, no other better person than a Filipino. But this has been a boon and a bane for us, a blessing and a curse. Kasi while it increases, international appreciation of Filipinos around the world, it also depletes us of important resources to take care of our local citizens. I'll take off from where Yusek Ronquillo ended in the last meeting, talking about how WHO proposed to manage this boon and bane for Filipinos. when they revised the health workforce requirements in 2016 to attain universal health coverage and sustainable development goals. So they reset it to here 4.45 healthcare workers per thousand population. I brought it back to the units used by the WHO, which is per 1,000, because that's the unit that healthcare workers use. It's our denomination. We understand if it's one worker per 1,000, we can always ask ourselves, kaya ba namin to take care of 1,000 people in a year? So the recommendation was 4 healthcare workers, professionals, 1 to 2 doctors, 2 to 3 nurses, and 1 midwife. Now, this is borrowed from the slide of Yusek Ronquillo. He correlated this with the practicing. Maganda yun kasi hindi licensed, no? And showed that we are far from 4.45. We're only 2.5 healthcare workers per Filipino. And that adds up to a deficit of 116,000 doctors, 125,000 nurses. We do have adequate midwives according to the data he presented. And the solutions discussed were training and recruitment. I'd like to focus on 2, which I will call retention and redesigning the workforce. So how do we retain the healthcare workforce? This is the problem that's hardest to solve because we cannot fill up a jar with a leak by adding more water. We need to seal that leak. And I've divided proposed strategies into internal and external. So some of the internal legislative solutions that ought to be discussed are revision of the PS cap for healthcare workers. Because this ties the hands of the LGUs. Protection of the Magna Carta benefits for public healthcare workers, because this is always the first to be sacrificed based on availability of funds. Expansion of Magna Carta benefits to the private healthcare workforce, including job security and benefits, other benefits. This is a personal advocacy for me, converting mandatory retirement to voluntary retirement. As you know, Senator Pia, I retired last September at an age where I feel that I could still be very productive. The mandatory retirement of 65 was set in the 1970s when average longevity was 65 years old. It's now a little more than 70 for men and women, and higher for women than men. So it really needs to be adjusted. Longevity for me at my age, so that's longevity at birth. For me at my age, average life expectancy is until 85. So I mean, many more years to support efficient healthcare workforce.
Let me just give a very quick, excuse me, Dr.
Yes.
Tony, just a
Yes.
very quick response. On the voluntary retirement or changing, at least revisiting the mandatory retirement. Ever since we discussed this now with you as an example, may draft bill na kami ng staff ko, and we have already given it to various agencies for review. So binulungan ako ni Attorney Mikey now na we've received their comments, and we'll be reviewing it kasi I feel like it's a low hanging fruit, no, na we should be able to do immediately. Thank you.
We don't like a mass strike like what's happening in France by raising retirement age. What we can raise is the age for mandatory retirement so that it becomes voluntary. Now, just a comment on return of service, whether it's 3 or 5 years, it shifts the migration rate to the right, but doesn't shift it down. So we still have the same rate of loss, but we're 3 years behind. So I think it's a band-aid solution for a gunshot wound, which brings me to the next set of strategies. External strategies, so controlling the workforce milieu around the world. So the WHO Global Code of Practice on International Recruitment of Health Personnel, I've shared with the staff of Senator Pia. But there is a provision there where this ought to become legislation, and if I may add personally, should become an international treaty rather than an optional code. The term of service is only one provision there. Other provisions that need to be supported by recipient countries for such as US and Canada, for source countries such as India and the Philippines, are funds for training. So they need to return the training funds we used to train the healthcare workforce they're pirating. And even funds for retention, so for salaries for people so they can stay in our workforce. And supporting concepts such as circular migration, where it's the opposite of return of service, where the return of services comes after a tour of duty in another country, where they will benefit not just financially but also training wise. In terms of redesign, I have 3 suggestions. Adjusting quantity. The WHO target of 4.45, I think, will aggravate brain drain in lower to middle income countries. So they're telling these countries that you need more than what you've already recruited. And that's going to aggravate our situation because they're going to get it from us. My suggestion is that we set appropriate density targets using local forecasts based on local needs. No? So 4.45 is an international mean, but countries have different needs and different systems and should estimate their own, have their own forecast for healthcare workforce density. Now, this is what's required. We need accurate and timely tracking. I think you said, Ronquillo pointed out limitations of our current data sources. They are late and they suffer from inaccuracy. But through our health information system, which should include a human resource database, and perhaps through the national ID system, we may be able to track volume and movement of our healthcare workers. Then another is to broaden services. Specifically, and we've discussed it before, Senator, the professionalization of BHWs. We've undertaken this for the past 6 years in some barangays in a rural and remote area, where our training goal is to turn BHWs into professional mothers or parents of the community. Because in truth, parents are primary care. When a person gets sick, most of the time, the first person you'll ask is your mother or father. So I'll show how this might be done in a while. This will entail standardizing their training, their qualifications, salaries, and benefits, because they do a lot without training, without target qualifications, without fixed salaries and benefits. Also, another way to broaden provision of services is through telemedicine. We've tried this in a rural and remote area, especially during the pandemic. And last but also very important, improving qualities. This is the great unrecognized inequity. We all recognize inequity in workforce, in funds, in facilities, but we don't recognize inequity in access to health information. So what we've tried in our rural remote experiment is to provide decision support systems for our physicians, doctors, nurses, midwives, and even our barangay health workers. So there are decision support systems for professionals as well as non-professionals, like the BHWs. This will help them become professional parents of the community and enrich the trust of the community in these community health workers. Now, a common route to end of all this, whether you're talking of tracking, providing telemedicine, or decision support systems for our workers, the root problem is information technology, which is the hardware, the software, and the networks, not just for the providers, but for the for the users, the patients themselves. So we really welcome the executive order signed by President Duterte liberalizing satellite access, which will enable these three possibilities to take place so that we can redesign the human resource system and think outside the box of 4.45 because I really think that's an impossible goal for our country. So thank you for the opportunity to present, Senator Pia.
Sige, just one other feedback on the presentation regarding professionalizing the PHWs, no? If you have a quick response to this or maybe later on na lang DOH, there is actually a test na course pala on PHW training. So I'm just wondering if this training is aligned with what you had in mind, Dr. Lee, or if you've had the chance to see it, and then maybe in the TWG you can all come together and give your thoughts on it. Kasi sayang naman, nandiyan na yung resources na Tesla is around. So I think that's the easiest track to follow, di ba, na i-maintain na all of them, if they want to receive that that official status, di ba, as a professional BHW.
Yes.
Kasi isang katutak na rin naman ng certification ng mga yan, and that I know, di ba? Lahat nagpapa-certify for whatever training. So just as you said, professionalizing.
Yeah. So I think Senator Pia training is good, but it's supply, and we need to solve the drain, seal that hole. We also need to specify qualifications. We need to regularize them and offer salaries. Some of them are receiving 500 pesos a month and are just, I'm wondering, still so happy to render service. And their benefits are all at the discretion of the mayor. And this need to be standardized, which is part of professionalization. I think training is a big step, but there are many other things to be done to professionalize BHWs.
I agree, and I think I'm asking my staff to check. I recall that that's actually one of the advocacy and bills of my brother, Senator Alan. The standard salary for the PHWs na. Ayun, regular employment status of PHW. So sama-sama na yun, di ba? If you meet the standard, you undergo the hours of training, then you should be professionalized and adequately compensated. But I think if I may add, and I'll leave it to the experts to hash this out in a TWG. How will the PHWs now, in their professional capacity na nga, work with the other health professionals in terms of providing for all the health needs of the community, di ba? Yun naman yung goal natin right? So, dun sa 4.5 na yan, 4.45, which sabi mo nga is may not be the most accurate way of quantifying our needs. I think the PHW should be part of that equation, right? I mean, that's a system that we already have in place and just really needs to be brought to that level of being accounted for, yung service na nabibigay nila, di ba?
Yes, Senator, last year we reviewed 7 bills in Congress on professionalization of the BHWs, but none of them were ever heard on the floor. I think some of the bills have been there for the past 4 or 5 years. So we haven't really had, I think, serious movement in terms of them becoming law. So maybe your group on for futures thinking might be able to push them forward. In terms of personal experience, we've tried. We have sessions with BHWs, around 200 of them every 2 weeks, from Bulusan, Sorsogon, and Samal, Bataan, and they really appreciate the training and the decision support system. We've taught them how to use it, and it's given to them for free. It really empowers them to render the care. So yung iba nga sa kanila naiiyak dahil natutuwa sila na they are being empowered. So this is something I think the BHW community and the community of patients under them will truly appreciate.
Thank you, Doc Tony. I was just telling my staff, see Dr. Vivian in my team, no, who also does a lot of this, as we speak. They are in, where now? Cebu. They're in Cebu. Although yung focus ng team ko is maternal health and infant health, no? But baka itong decision support system nyo, masama nyo na rin siya dyan para ma-include na rin niya in the training, di ba?
Yes.
Sige.
Kasama siya. Meron dyan on maternal and child health.
No, I
It's
mean,
included.
Dr. V can, if she can access
Oh,
your
yeah.
decision support system so that when she does her own outreach on my behalf, she can include
okay.
this. For over the years, yung focus namin has really been maternal health, no, and infant, so or children's health.
Yeah.
So sige, thank you so much, Dr. Tony. I know you have clinics.
Thank you.
On a number of matters, and we'll invite you again for the next step. Thank you so much.
Thank you for the opportunity. Thank you.
Your input is always very on point. Thank you.
Thank you.
Okay, so next, as I mentioned, no, Dr. Marilyn Lorenzo is online. She is a professor of UP Manila, and after Dr. Lorenzo, we will have PMA and FNU and PHA. From my recollection, last week. No, sila yung nakaabang na sa atin last week. So thank you for your patience. I will prioritize all of you today. Go ahead, Dr. Lorenzo.
Good afternoon, Senator Pia and your committee on SDG, Innovations and Futures. As requested, I prepared a short briefer on specifically on the Special Health Fund. So this is short, but to give some background. Next, please. Next, please. The background of this is we remain as one of the poorest performing countries in the region for health. This is a slide borrowed from Dr. Berhere in one of our last meetings. Now, if you look at these statistics, life expectancy of Filipinos, it's always going to be poor to be a Filipino, relative to our neighbors, because the average Filipino will only live to be 71.4 years. The rest are living longer than us, even if Indonesia is only slightly older. This is significant because life expectancy, as we all know, gives us the sum total of the quality of care that citizens of a nation enjoy. And this is validated by all the other statistics. If you look at maternal mortality rate, ours is the highest. Many more mothers die in the Philippines than in other ASEAN countries. Infant mortality rate is the same. And if you look at out-of-pocket expenditures, ours is also the highest at 48.6% of income of Filipino families. So next, please. So if we look at this, we ask ourselves why, no? And of course, one of the reasons for the poor performance of our healthcare system is because of health workers' inability to do what they need to do. So next, please. Health workers, especially at the primary healthcare levels, need immediate support. What kind of support do they need at this point? The first one is decent work and positive practice environments. In a recent UP College of Nursing meeting, several studies that were done by our group and others pointed out that there were three main reasons for non-retention of nurses, and it's not all about money. The first one is about work environments, whether their jobs provide decent work, and if they have prospects of career development and progression. The second is the work environment giving them the requisite materials, support, and technology that they need. And only third comes pay, salaries, and benefits bundled together. So it's very important to provide investments for this. Also, direct investments in healthcare facilities are needed to create positions for them. And when we talk about positions, we're not talking about JOs or job orders. Materials and equipment to enable them to work well. It's well known in the nursing world that we are a technology challenged nation in terms of exposing health workers and especially nurses to the materials and equipment they need. And there has to be more investments given to cutting edge training to enable them to function well in primary care sites, espousing PHC. There are more training available in hospitals, but for primary care, these are far and these are few and far between. No? So we want to emphasize that there will be no UHC if there are no health workers that will be recruited and retained. Next, please. So what may give this immediate investment? Well, DOH, Dr. Burheri also shared with us the new strategic thrusts of DOH as far as UHC is concerned. And one of these is enabling people to be healthy, protecting them from health risks, caring for health and wellness, and strengthen health institutions and the workforce. And we'd like to focus on the strengthening health institutions and workforce. Thanks, please. Their thesis is with strengthening the workforce, there will be a healthier country, and healthier Filipinos. So the government right now is pushing to strengthen institutions and workforce. In the short term, they're setting up action centers for healthcare workers and fast lanes in hospitals to fast track benefit provision. And I emboldened the move to train 300 public health experts in the next 5 years abroad, which I hope they will rethink. And setting up action centers also for hospitals, I hope can also be rethought to actually set up action centers more for primary care. In the long term, they're thinking of creating mandatory service programs for students and graduates of health courses. The return service agreement that Doc Tony also discussed, which I support. And our experiment at UP Manila bears this out. No, there are a lot of LGUs that have expressed satisfaction in at least getting good, very well trained health workers, even for 2 years alone. Entering into treaties with other countries to invest in healthcare worker education long term is also something to support. But this has already been done in the work that we did with mutual agreements. The problem is the implementation of this is very poor. We have no instruments to compel those that recruit health workers and especially nurses from our shores to implement their commitments. So next, please. So then now comes the health, the special health fund. Next, please. Next, please. The special health funds. So we've said that the investments in primary healthcare workforce are needed immediately, as in really now. So next, please. So when you look at what level of investments are we talking about, and how underinvested are we? You will see comparison countries and regions. In the Philippines, in primary care, we only invest 4% of our GNP. But in the EU and the US, of course, first world countries, the figures are 13% and 5.7% respectively. And for the Philippines, vis-a-vis ASEAN countries, we invest $6 per capita, and 20 and other countries, including that of Vietnam and Malaysia and Indonesia, have an average of about $20 invested in primary care. So their primary care systems, and most of these are expenditures in health workers. Next, please. So we can actually do this.
Question lang, no? Can you go
Yes
back
po.
to the last slide? Yeah. And it's unfortunate na wala na si Dr. Tony Dance, but we can just inform him of my comment. Dito sa last slide nyo, I'm a little little bit, I have some concerns kasi we are somewhat of a model in terms of the laws that we have passed on sin tax, no? Which directly contributes to health infrastructure, equipment, and medical assistance. It's not a
Yes.
small amount. I'm just curious na despite that, ganun pa rin tayo kababa sa neighboring countries kasi I know that we're called out for those good laws. So I feel so disappointed na despite that, so saan napupunta yon? I mean, I get it na wala namang specific doon na primary health yata. I think it refers to universal health. And universal health is basically primary health. So I'm
Ah.
surprised, and I'd like to, I don't know, like, what's the basis to consider primary care? And on that note, on the positive side, in my other hearing, the other day on, what was my hearing? STG, what was the topic? We had a hearing on the baselines and where we are with the sustainable development goals, the tracking. It was emphasized there that because of the latest syntax law, wherein I personally included the amendment that a certain portion of the collection will go to SDGs. And a big component nga is health pa rin naman. So that's the good news. Madadagdagan pa. But yun nga ma'am, ano bang coverage nun na matrack ko?
Yeah.
Saan napunta?
Yun ang problema kasi Senator Pia, if you analyze our national health accounts, most of the increased expenditures in healthcare now go to hospitals. And also, well, sad to say this, but I think Tony will agree, to doctors, many of them, especially to the private docs. Very little of this increased expenditure amounts go to primary care. When we talk about primary care, we're talking about, of course, the barangay health units, the municipal and city health centers, and the and level 1 hospitals. Hanggang dun sana kasi yun yung referral hospital. But unfortunately, you will see, even if you look at our landscape, health system landscape right now, level 2 and level 3 hospitals are very well developed. But we all know that these are not what our people need, no, on a daily basis. So
I understand what you're saying. Let me show you from the perspective of the lawmakers who are the ones who make that, well, not necessarily the final decision kasi nga kung ganun ka-general yung provisions namin na it doesn't go specifically to primary health, doon na pupunta. But I'll tell you why. Yung lumalapit kasi sa amin, ang pangangailangan nila is heart surgery, lang ganito, yung malalalim. So, in the minds of an ordinary lawmaker, yun yung, tapos lalapitan ng mayor or ng provincial governor or ng anong tawag dito, administrator ng hospital, sasabihin na wala kaming ganito. And so I think it's like that proverbial example that we have na the 6 blind men and the elephant. Diba? Kayong mga primary healthcare advocates, and I'd like to include myself there, nandun tayo sa tail, tapos yung pinapakitang image sa iba nandun sa trunk, so ibang-iba talaga. So I'm very happy that you pointed this out because I do have the power to dig deeper, and even maybe in the budget we can specify, and in the next hearing or TWG, I want my team to zone in on this so that we can really make himay where does it go and what can we do about it, because I understand now what you're saying, but offhand, no, and I'll see if my team can pull it up within the time of our hearing, that there's an allocated budget for primary healthcare facilities. Ang laki din nun, that's in the billions. So hindi naman sa hindi nalalaan. Do you have that offhand? Can you get it? That's huge. I don't know offhand. I do not know in comparison to what we put in for level 3 hospitals or even level 2. Pero I'm surmising bigger pa rin naman yung nalalagay natin sa primary health. So at least the objective is there. Let's just do the numbers because I understand what you're saying, but I cannot accept na in the end, ganun kalala. Kasi I think DOH has tried, no, to fear it. And before ka naman maka-level 2, level 3 hospital sa lugar mo, di dapat may level 1 hospital ka naman. So, but ang gastos kasi ni level 2 and level 3, baka that's the reason for every level 3 na pinupondohan, ilan yung sinakripisyo mong barangay health centers, primary health care.
Yes.
10 ba yun? 100 ba yun? Maglagay pa ng ganito. I will be the first to say, sandali lang, this is an established allocation of priorities. Kailangan nating habulin. I would have done that. So I'm very grateful for this presentation. But to be clear, this administration, the previous administration, no one ever presented that to me. See, now looking at me, she's been with me for more than 10 years. Wala. Diba? Wala. Okay? So, I'm your champion. I will get it done. But present it to me because no one's, and I do the best I can. And everyone who's been involved in healthcare knows that I'm a primary healthcare advocate. But if I don't have that information, believe me, I don't think anyone else in the legislation, in the legislative, involved in the legislative process who can make a difference has that information either. Okay? So this is a good breakthrough because now I know what I do not know because you haven't given me that information. Okay? Thank you.
Okay.
Thank you, ma'am. Thank
Sige. You're welcome. So going on, so we go into the requested focus. So when we invest, where can we get some of the sources of the funds? Next, please. So we already suggested that we look into the special health fund because the UHC law, RA 11223, provides for this. In section 20, it says that the province-wide or city-wide health system shall pool and manage through a special health fund all resources intended for health services to finance population-based and individual health services, health system operating costs, capital investments, and very importantly, remuneration of additional health workers and incentives for all health workers. So areas, local governments that cannot that do not have enough funds for hiring additional health workers that they need, may use the special health fund. But the provision here that DOH in consultation with DBM and LGU shall develop guidelines for the use of the special fund. From what I know from my colleagues at the DOH, because I keep asking them, how is it that some of the areas that we visit still does not access the special health fund? And I was told that there are problems with the guideline setting with DBM and LGUs. And so the special health fund has not been set up even 4 years, 5 years down the road from the institution of the law. Section 1021 also gives us an idea that PhilHealth actually will help fund this special health fund. Next, please. So if you look at a rendition, it did not come out. There was a slide that I put in that we have very many sources of the special health fund. Sayang lang that it's not being used. But what are the quick recommendations to your committee, Senator Pia? Next, please. We can please.
Ano yung iba-ibang sources ng special health fund na yan?
Ano yan? There. You have national government financial grants and subsidies from PhilHealth. You also have ODA, NGO, FBO financial grants and institutions that are already earmarked for local health funds. And then you have of course, the LGU budget for health, that are earmarked also for the special health fund, especially for health workers. Ang malungkot po, ang nangyayari lagi, nahuhuli yung paggamit doon sa health workers. So health system operating costs, capital investments, paggawa ng infrastructure, laging meron yun ang dalawang funds na gagamitin. Pero yung remuneration of additional health workers and incentives, especially for all health workers, that is a big problem up to now that has not been funded. And then population and individual-based services are funded also by the LGU-based fund. So sana kung if there are uh, well, guidelines that can be forged very quickly, this special health fund can come into being and be used. Meron naman dapat special health fund utilization tracking system. So hindi dapat yan prone to corruption sana. But maraming possible ano yan. So pati yung mga bilateral grants for health, pwede ring mag-set aside for the special health fund. So the quick recommendations for your committee, Senator Pia, are the following in the next slide. Sana we would like to request your committee to look into the status of the special health fund implementation, because this is so important, and see how we can move this for its immediate release and monitoring. If it is the guidelines that is the bottleneck, then get groups together, and the UHC study group of UP Manila is willing to help out here in coming up with the guidelines to make it simple, and talagang it will go to primary care that really needs the funds most, especially for health workers. And then maybe determine whether there's a need for supplementary legislation at various levels. And I'm not talking only at national levels, because like the Tobacco Regulation Act, it was very successful because there were also mirror legislations at the LGU level, yung mga ordinances po nila. And if this is what is necessary, then we should probably get together and come up with model ordinances to get the LGUs to also put up a fund or contribute to this fund. But that should be done now. And then one special quick recommendation with regards to nurse migration. This is a special advocacy also, and you know this, Senator Pia. I'd like to request for us all to think about how we can slow down current recruitment of health human resources, especially nurses. One idea that I had was, remember how we regulate medical missions, how DOH regulates this. We put up something to check whether or not the medical missions indeed are helpful, or if they come up or they are in areas that are in need of the medical missions. All the recruiters, most of the recruiters, if not all of the recruiters of nurses and student nurses, actually come into the country unimpeded. No, they go straight to hospitals, go straight even to schools, without any checks. We have to slow down this kind of recruitment, kasi yun nga, what worries us is the recruitment becomes now unethical. They recruit whole teams of cardiovascular surgery teams, no? And so when they recruit this to one hospital abroad, they don't have any more downtime. They don't need to be trained because they work well together. In the meantime, it's our healthcare capability here that's hampered. So we have to have longer waits of specialized surgeries because these teams have already been recruited out. Dapat hindi nagawa yun. Also, we have to specify, just how many health workers, especially in health facilities, can be recruited at any one time. Pag na-breach na yung level na yun, dapat wala ng recruitment. We talked to the Department of Migrant Workers at one time in casual conversations, and they were saying, if you get asked to declare, your nurses or specific kinds of nurses or those with specific skills as mission critical, then we can actually slow down or put caps on the recruitment. But I was thinking that because of this critical shortage that we are now facing and is still continuing, we really have to think about how to slow down this current unethical recruitment. So that's it for now, Senator Pia, and I hope this will help. Thank you.
Yes, very helpful. In fact, before I get to go to the next resource person, I'd like to get the quick reaction para we can have a little bit of a discussion here, Dr. Lorenzo, from both DMW and DFA, no? Si Dr. Lorenzo was basically saying that unethical na talaga yung ginagawa ng ibang recruiters. They will go to our hospitals or our schools and wholesale get the whole group, no? Which to me is really like, that's terrible. Like, I mean, honestly, I use the term, it's modern day colonization. Like they just come in and in as much as I will repeat, I respect the right of every Filipino, nurse ka man, abogado ka man, ano ka pa man din, to choose their own future. I am not comfortable and I cannot tolerate that they come in and wholesale recruit this whole group and then paralyze, a sector of our healthcare that is providing these services to our people, whether it's private or public. So I'd just like to get a quick response later on naman. We'll talk some more to DMW and to DFA. Now, are these interventions that are easy to make? Are these kind of interventions that similar to the protests that you make on some more headline type of materials na, this is unethical, this is jeopardizing the term that Dr. Lorenzo uses. Is it mission? What was it you said? Is it mission?
Mission critical.
Pwede ba natin gawin yan? Kasi that's something I'd like to do immediately. Who would like to speak first? I leave it to both the two gentlemen to decide.
Hello. It was a pleasure. A few points from the DFA's perspective. When nurses come in, our main thrust, of course, is not the deployment, not the regulation, no, but the protection of their rights. And you're aware of, for example, New York, the consulate was in touch with one of our colleagues from law school, in Attorney Venuan, protect their rights, no. Dr. Lim,
Dr. Lorenzo.
Yeah, makes strong comment, marks, and by and large, like you were learning from them. No, but for example, when we talk to nurses abroad themselves, well, they say the main problem is the economic opportunity, and that and this one is something they claim that there's no brain drain.
There's no?
Brain drain. There's sufficient nurses
okay.
available, but except there are enough graduates, except that they don't work as nurses.
Correct,
What do you
but
think?
okay, I understand, and you're sharing with me the perspective of the nurses that you speak to, and I recognize that, and I value their comments. They are true insofar as their perspective is concerned. Like I said, they have all the right to choose to work abroad. I have no qualms with that. I have friends, family pa nga. I have family who are nurses in the US. But from a government's perspective, no, from an advocate's perspective, I need to understand what can our government agencies also do. We worked on that last week, so it just so happened na I don't know kung wala pa yatang DFA invited sa hearing or wala kayo dito last week na I committed to work on that the environment, and Dr. Lorenzo herself mentioned that where I took notes sabi ko, meron na nga akong may iPad na ako ng presentation niya, nag-notes pa ako. Because it's really important to me, what are the reasons why they leave? Because what are the decent work conditions here? What are the growth and career opportunities? So noted naman yan. Noted yan, valid yan, okay? I'm very careful because I don't like to be misquoted. I am for the personal growth of every individual here. But the perspective I'm looking for is what can DFA and DFW do by way of bilateral agreements, by way of telling these countries that are either sending government missions or private. So I wouldn't know, ano bang say niya pag private, di ba? Na teka muna, grabe na yung ginagawa niyo dito. Pumunta kayo sa isang hospital, sa isang probinsya, tinanggal niyo yung buong division na nagmang-maternal care or nag-emergency care. Can you do this to us? So that's my question. Can that be addressed? Can you handle that?
Certainly, from perspective for because usually when we negotiate bilateral labor agreements, and in this case, health agreements. We're only concerned about the process. Sinong agency ang involved, ang in charge dito, sinong agency in charge doon. But this would entail a holistic negotiation, because holistic process, all of government process. Instead of simply, we'll have to change our paradigm shift. We'll have to change our mindset. Instead of just, now of course we defer to the DMW negotiations, although kami pa rin ng lead sa international operation, no? But instead of just talking and saying, say, how will they be protected, how will be they recruited, dapat kasama siguro sa mga interagency meetings natin, yung other agencies involved, CHED and all that, in discussing the Philippine position, which we will raise with them. Except the other side, kasi usually they're represented only by the Labor Ministry maybe, or the Health Ministry. So things like this, yung in advance with the SNG is like, in return naman that you're working, dapat hindi ganito, dapat hindi ganyan. Or you have to help fund their own public health system, for example, or provide a scholarships. Well, we can raise that certainly, except they will also have to engage other ministries in their countries for the negotiation. Usually yung mga agreements na to are just executive agreements, no? And gusto naman madalian, not to
Because,
take long.
let me just
Paradigm shift, yes.
agree with you, it is a paradigm shift, but this has been existing for years. So my challenge to every one of you sitting here now, do we want to solve this during the time that you, me, us, we are sitting here today? Kasi, how many years ko na tong alam na problemang to, I feel bad na no one has ever taken the lead on this. And now that we have a Department of Migrant Workers, my understanding of your job is the welfare of the migrant workers who are there. So that's why, in my limited understanding of your interaction with DFA to, kasi if I say, I need you to protect the Philippines, I'm not talking about its territorial waters, I'm talking about the health of the Filipinos na by the gallon, by the wholesale nga nila kinukuha yung mga health workers natin. Help me negotiate. I want you to tell me. You tell me, how do we do that? How do we negotiate? Agree, paradigm shift. Dictate to me, because I will hand it to you on a silver platter and get the people involved so that we can do it. The document that Dr. Tony Dance mentioned, we can share that with all of you. This is not new. Other countries have been more proactive in protecting their healthcare system. They ensure that if you are going to invite our health workers, then you go through us. Huwag kayong dumiretso sa isang 18-year-old na bata at sa kanyang magulang na gusto lang naman na gumanda buhay nila. Huwag nyo gawin yun, di ba? That is abusive behavior. And I'm so happy that you are nodding your heads kasi, di ba, we all want the best naman for our individual families, but collectively as a nation din naman. So lahat kayo nagganat, maraming salamat. Join me every day. Napagawa naman natin ito kasi it's not gonna change on its own. And we need political will. And if I have to ban, I will ban. I will ban direct recruitment. Not because I do not want I once was young. I went abroad right after graduating, not because gusto ko munang tumira sa ibang bansa, but I just want to explore. And I don't want to deprive every youth of that opportunity. Choice na lang niya, as it was my choice to come back to my country. It was my choice to come back to my country, to go to law school and to live in this country. I hope that is a valid choice we can offer all, right? So kung gusto niyang mamasyal doon, mag-masters doon, magtrabaho ng 2 taon, tapos bumalik, yan ang gusto ko. Ayaw niyang bumalik, fine, pero may opportunity siyang bumalik. So, huwag natin paghalu-haluin yung issue because we will divide these issues.
Yeah.
Do not keep saying kasalanan natin dahil walang career path. No, we'll handle that. We'll create this career path. Ako lang ang fund na binabanggit ni Doktora, okay, himayin natin kasi like I said, eto naman ako, wala namang nagbigay sa akin ng tamang proportion ng pag-allocate ng budget. I'm open. It's my job. I have the last say is Senator Angara, because he's my boss. He's the chairman of the Committee on Finance. But he will listen to my recommendations if I say, eto tayo sa basic healthcare, eto tayo dun sa other beyond basic healthcare. So, on that note, pakinggan naman namin ikaw, ASEC, sandali. And these are just responses to these recommendations, no?
Okay po, maraming salamat po, Honorable Senator, Madam Chair. From our perspective naman po, where we are mandated to balance yung freedom of movement as well as the right to decent and gainful employment overseas and the promotion of welfare of OFWs, we do have concrete strategies that we can pursue. And I'll cite very concretely one that is closest to the heart of Secretary Ople, one that she's advocating for right now, is that yung initiative po ng contribution towards sustaining the viability of human resource sa pamamagitan ng initiative ng pagsusupport sa higher education ng ating mga bilateral partners. For example, specific communities that are host to students that are enrolled in the healthcare discipline, bubuhusan natin ng scholarships. Number 2 po, meron
Sorry,
actually...
when you say bubuhusan natin ng scholarship, dapat yung kausap din natin ng mga bansa, magbuhos din sila ng scholarship.
Yes po.
Oh, that's what you meant, okay?
That's what I meant, Madam Senator.
Oh,
Opo,
diba?
opo.
Sinabi ko na to before na para tayo nagpapaaral ng health workers ng ibang bansa.
Yes po. Yung pong country of destination na bilateral partner natin will have to pitch in, will have to contribute to the education of our future supply. That's basically...
Recognize that because
Opo.
that is a reality. Kung tayo nagbumibili ng resources sa ibang bansa, kinukuha nila yung resources natin na wala man lang kabayaran.
Yes po.
That's the reality.
And then number 2, Madam, would be yung clear na reintegration tsaka circular migration na program natin. Meron po kasing policies based na sa Republic Act 11641 where we can strengthen the reintegration and return migration program of government. If there's a clear career pathing for our healthcare workers, specific for our healthcare professionals, then there's a chance that we could entice them back and retain them here in our country bilang professionals who go beyond doon sa sinasabi nga po ni Doc kanina na yung retirement age natin is going longer and longer and we can still be productive and contribute to our society even beyond 65 years
I
old.
just think of it this way, no? If at around 22, graduate na ba sila niyan? At 22 with senior high, at 22, graduate na sila. Sabi mo na lang, 24 sila mag-start ng career doon. 30 years. At 54, regardless
pa
na
po
with
sila.
full benefits in some country,
Opo, marami
you
pa po
always come
silang
back.
20
Be a part-time nurse, part-time health worker, professor, ang dami, pero wala tayong program.
Yes po.
So I'm here to help, but I need people who will make those programs.
Yes po. And third, Madam Senator, would be there's actually policy space for the implementation of what Doctora has earlier mentioned on mission critical skills. Kung kinakailangan pong yung MCS mechanism natin ay ma-regulate rationally yung outflow ng specific occupations at a certain period in time kung saan hindi ganon ka-viable yung supply, then we can also do that. Kasi meron naman po talaga tayong policy space for that at the Department of Migrant Workers. Number 4 would be
That's not very popular and that wouldn't be my first ano naman. Kasi syempre, tatamaan dyan, depende sa batch na tatamaan. Kawawa naman din. So hindi naman natin gustong mangyari yun unless crisis na crisis katulad
yes po.
yung height ng COVID, di ba? But you're right, it's your job naman to tell us na gano'n. But I'd like to emphasize na we're really looking for these great programs na anyone can have that choice kung saan. I mean, if when you were mentioning na how to entice them back, simple lang yan for me eh. I've reached barangays that I don't think the average person can reach because you can only go there by foot, by walking sa mga bundok. And why are the teachers still there? Why are they there? Why didn't they go? Why did they pursue another profession? Because they like to live. Diba? Gusto nila yung sariwang hangin. They want to be among their family. So there are different reasons that will entice different people naman to either stay or come back. Nasa sa kanila na yon, diba? The choices are there. Yun lang naman yung sa atin eh, diba? Na mabigay yung choices na yon.
And number four, Madam Senator, would be yun din pong revolving around the idea of ethical recruitment. Ito po yung co-management, bilateral co-management ng healthcare worker supply by implementing ethical recruitment principles doon po sa mga bilateral labor agreements natin na sinasabi nating not properly implemented. Pero may mga provision, may mga giving back provisions yung ating mga bilateral.
So may model ka na yan?
We,
Or it's just a concept?
mayroon po sa Saskatchewan and other
Ano nga yung
provinces.
Merong
in
ganyan
Canada.
ng ibang bansa eh. Matagal na, 12 years ago narinig ko na.
Opo.
So, sige, good yan. Can you wrap up lang? Only because I have another resource person. I'll call you pa naman later.
Yes po,
But-
just two short
Okay,
points na
go
lang
ahead.
po, Madam. Yung strengthened na pre-departure tsaka pre-deployment services ng ating gobyerno, where it should be the whole of government, whole of society, whole of industry approach para well-informed ang mga aalis na professionals natin, what are the gives and what are the takes when they leave the country, ano yung mababakit nilang wards, ano yung departments ng hospital na mababakit nila. That should be strengthened and specifically para po sa sectors that matter, for example, the healthcare sector. And the last point, Madam, would be siguro yung pagiging mindful natin na we, at the international level, contributor po tayo dun sa UN Global Compact for Safe, Orderly, and Regular Migration. And that Global Compact is also mindful of the sustainability of international migration. Yun lamang po yung aking 6 quick points, Madam.
Very nice.
Thank you.
Very nice. I'll text Secretary Ople later kasi aligned kami dyan. I'm very happy. Thank you, Asek. Okay, we have a resource person who I would like to call because she is boarding a flight, no? Unahin lang natin. Well, siya naman talaga ang next pala. Dr. Minerva Kalimag, who is the president of the Philippine Medical Association. Ma'am, thank you for being with us last week pa and today you have the floor.
For our part, I will just flash on your screen is our the number of members of the Philippine Medical Association. Can you hear me?
Yes, we can hear you.
We actually have 93,904 members as of now. And if you will notice at the profile of members, most of them are in cities. For cities, whether in the provinces, in city, Davao City, Zamboanga City, all of these different component societies have members, something from 1,200 to 7,000 members. The biggest is actually in Quezon City and in Manila. Okay, so now the next thing is for the members who are active, we all actually have active membership of about 60,000. For the 93,904, this is actually aligned with the number of active members who are renewing their licenses with the KRC. So, as to the profile of the different specialty societies, can I have the next slide, please? So, if you notice, we have 8 specialty divisions, and they have a track record of actually producing specialists from 62 years to a maximum of 86 years for the surgeons. Next. So here are the number of residents in training. This is for 1 year. And of course, these are divided into different year levels. So if, for example, we have a total of 9,761 for maybe about 1/4 of that are graduating every year. And they are the ones that are actually being deployed by the Department of Health before they actually go into fellowship training. So these are the residency trainings, and the number of residency training programs are 717. Next slide. So for the number of subspecialty societies, across the 8 specialty divisions are 75 subspecialty societies. And then training programs, we have then 42 numbers of number of fellows in training at 1,616. So if we get a summary statistics of that, we have the next slide. We have at least 11,376. Now our problem is actually maldistribution. No? As I've said, many of the physicians that graduate as specialty trainers are actually going into the cities, no? And then we remember for the Philippine Medical Association, the Association of Municipal Health Officers are actually included the Society of Physicians in Public Health, those in physicians in academic settings also are included in the Philippine Medical Association. So I think one of the things that we would like to recommend is really to fast track the integration of the medical profession. Senator Tia, with your help on that. Because we want all of the physicians to be able to be on board so that we will be able to cross collaborate with the Department of Health regarding the manpower distribution. I agree that perhaps we should also look into the proportion of specialists, for example, because if we are going to have, for example, these specialty hospitals that are being developed in the different provinces, we have to also look at the accessibility of these hospitals. For example, if we have an Apex Hospital, for example, in Cagayan de Oro, the Northern Mindanao region, for example, Bukidnon, the next place no, is 2 hours away from Cagayan de Oro. And then the other, Hingorog Medina, for example, is also 2 hours away. Camiguin can either go directly to Cebu by a plane or go by Roro to Medina and take the 2 hour round trip. So we are, our difficulties actually are in the what do you call this, accessibility because of geographical distance. So these are things that we have to consider, no? Especially the deployment once the hospitals for uh, specialties no, are already in place. So we hope, I hope that we will be able to have a better profile once we cross those, what do you call this, checklist with all of the data that we have with the Department of Health. Also, another thing that we have to consider is that perhaps many of our physicians, also in the Department of Health, can be actively recruited for work in different areas. Thank you.
Thank you, ma'am. Maybe I know you are catching a flight, no? So I couldn't hear everything you said clearly, but I'd like to invite you to a meeting then, siguro, and then meeting or hearing, no?
Yes.
But and be more inclined to have a smaller group at the next level, because what I feel needs to be done along with UH is to pinpoint where are the areas that we don't have enough doctors and what do we do about it, di ba? Ano yung solutions natin?
Yes po.
And I recognize that you discuss specialties and all. In our previous discussions and even today, ang emphasis natin is primary health care. So
Correct, correct,
I
correct.
know in other countries, aside from iba tayo, when they finish med, you're a general practitioner. But there is a subspecialty now that is family medicine. And I know in other countries, just from my chats with doctors, Europe, graduate ng medicine, hindi ka pwede mag-practice without a supervising doctor. Kasi parang doktor ka nga, pero you don't have a specialty yet. So parang you're only released to become a independent on your own after that parang residency mo, and that would be like yung higher level ng GP, my understanding is yung parang family med nga. So we really have to explore these things, no? In the last hearing, I pointed out that even sa curriculum, and Dr. Milabel, I'm so happy that you're here with us because I really wanted Chen to be involved in this, no? Na how do we help young people and their parents, because obviously it's from the school, may influence naman talaga ang parents, determine their future careers. And if it's not clear to them, then naman na yung lahat ng career option, sayang din naman. Sayang din naman na hindi nila makuha yung career option na nakakatulong na sa bayan, maganda palang opportunity sa kanila. And again, I will repeat the example I gave na sinabi I think kayo ba yun, Yusek, nagsabi, or who was it who said last hearing na kulang ang, walang, or what, sorry, I can't remember who the resource person was, but the statement was, walang takers ng occupational therapy sa I think 2 SUCs or overall, whatever. And then nagtingin na kami ni Senator Villanueva, kasi we both know personally, from personal experience, napakahirap maghanap ng occupational therapy. So bakit walang takers? Diba? So again, of course, alam natin, career path, greener opportunities, whatever. The point is, hindi lang naman pwedeng sabihin na walang may gusto mag-occupational, di ba? Hindi na po-promote yung careers na yan. Anyway, so thank you, Dr. Kalimag, but the initial info you gave us, gusto ko pa talagang himayin to sa susunod. Maraming salamat po.
Yes po, yes po.
Thank you. So let's go now to our next resource person from Filipino Nurses United, the National Vice President, Ms. Maristela Abenojar. And then after, we will call on Ched and Neda.
Okay. Magandang hapon, Madam Chair, Senator Pia Cayetano. Ganon din po sa lahat ng resources speakers na nandito ngayon. We are very thankful na na-invite po ang Filipino Nurses United, no, to present our recommendations. As you already know, Filipino Nurses United is a labor association of nurses, and we do agree with the intention of Senate Resolution. Hello? Am I
We
clear?
can hear you. We can hear you. Yes, go ahead, ma'am.
Okay. And we are in agreement with the Senate Resolution number 536 to really investigate on the status of our healthcare workers, no? Because for a fact na naniniwala kami na the improvement of our healthcare system to become responsive must also be not only looking at the welfare of our healthcare workers, but also the health needs of our clients or of the Filipino people. So I will not read as advice the statement of FNU, but I will go straight to some of our recommendation. We know for a fact na itong pong ating nursing crisis ngayon is actually a health crisis, no? It is ironical nga po that we are one of the highest exporter of nurses in the whole world. Sabi nila wala daw walang bansa na walang Filipino nurse, no? And yet, eto tayo, we're suffering from chronic understaffing. Hindi ho namin ito tinatawag na shortage because as the statistics been presented by our first resource speakers last March 27, we have enough supply of nurses. Sabi nga ni PRC Commissioner Erwin Enad, we have about 590,000 active or licensed nurses out of the 951,000 plus registered nurses. So, ang tanong din, nasan yung iba? Nasan yung iba or bakit hindi active ang iba? Well, we know for a fact na issue ito na pinalala ng COVID-19 pandemic. But now, at present, pinapalala naman ito ng patuloy no na recruitment ng ating mga nurses palabas ng bansa. We believe that we have to focus on the root causes of this, no? Kasi nakaka-affect na talaga ito sa patient care natin. So number one, kailangan itaas po ang sahod ng mga nurses. Alam natin na sa pamahalaan or sa gobyerno, after 18 years na naipasa ang nursing law, doon lamang ipinatupad yung salary grade 15 at entry salary. But until this time, marami pa po ang hindi nag-i-implement ng salary grade 15 o itong 35,000 plus. Meron po kaming mga members from other provinces like from Surigao and Agusan na nagki-claim na wala pa po silang hindi pa po ini-implement ang SG-15. SG-11 pa rin ang tinatanggap nila until now, no? Pangalawa, gusto rin po naming sabihin na itong sahod na ito ay hindi na commensurate or enough doon sa cost of living ngayon. In 2018, ang Ibon Research Foundation po ay naglabas ng datos na kailangan ng 32,000 a month para po sa monthly cost of living. But that was 2018, no? So 2023 na po tayo ngayon. At we are aware of the inflation rate na dinaanan natin. Kaya hindi talaga nakakabuhay ang sahod na meron tayo. Pangatlong concern is, hindi naman po pinapatupad ang SG-15 sa lahat ng pantay-pantay. May ibang mga LGUs na mas mababa yung amount na pinapatupad because of the income na sinasabi nila na hindi nila afford, no, na ipatupad ang SG-15. Also, ang counterpart natin na nasa private sector, ang ating mga nurses in the private sector are only earning 570 pesos per day, or that is 12,540 pesos a month, no? 12,000. Saan aabot ang halaga na ito? Natatanggalan pa to ng ibang deductions, no? Kahit single ang ating nurse, hindi siya mabubuhay, lalo na kung may dependent siya. So, ang isa pa ay meron tayong regionalization ng wage board. Kaya sweldo sa NCR na 570 pesos a day, iba yan paglabas mo ng NCR. Merong equivalent yan ay nasa 300 plus lang a day, no? Masyadong mababa. Kaya po kami sa Filipino Nurses United ay nananawagan sa ating pamahalaan na it's time to increase the salaries of our nurses. Yan yung isang push factor. Bakit maraming nurses ang nagre-resign at lumalabas ng bansa? We want a just and living wage, and we recommend 50,000 pesos entry salary, both public and private. So ang tanong, paano sa private? We recommend na sana the government will subsidize our small and medium scale health facilities. Ikalawa po is security of tenure, no? Ang alam natin na ang nursing ay essential and vital, no? And in fact, we are the largest workforce in the health sector. Kaya nga 24/7 na trabaho ito. Hindi ito seasonal. So hindi dapat kinokontractual, dapat regular kaagad yung position. And yet marami tayong contract of service, job order, no, at nurse deployment program in the past, no, na itong implementation ng Bandanas ruling ay libo-libong nurses ang nawalan ng trabaho dahil nung na-redevolve ang health programs from DOH to LGUs, marami po ang hindi na natanggap or ng LGU na NDPs. Batangas alone, 500 plus po ang natanggalan ng trabaho na NDPs. No? Kaya gusto natin na maging secured. Hindi po dapat ginagawang contractual ang trabaho ng ating mga nurses. Dapat siguro imbestigahan din ng ating committee kung ilan ba talaga yung vacant plantilla position na meron tayo at ilan yung dapat na kinikreate na plantilla position. May tendency kasi minsan sa infrastructure enhancement, facility enhancement, nagdadagdag ng beds, ng bed capacity, hindi naman nagdadagdag ng personnel. Alam po ba natin na ang nurse-to-patient ratio ay greatly affected by this chronic understaffing? Lampas-lampas po ang bilang ng pasyenteng kinakarga ng ating mga nurses sa ospital. Sa Department of Health, sinasabi nila ng standard ay 1 nurse to 12 patients sa isang regular ward. Pero ang current ay nasa 20 to 50 patients sa isang ward. Sa mga mental hospital patients, ang ibang nurses natin ay 1 nurse, 100 patients, no, sa isang ward. Yun ang kanilang inaalagaan. So napakalaki nung risk na kinakaharap ng ating mga nurses. Pero hindi po ito nabibigyan, no, ng particular na attention. Nais din po naming ipaabot sa committee na ito na itong contractualization ay patuloy na ginagawang practice sa ating mga ospital. At kung hindi man nila ito ginagawa, ini-increase nila ang work hours. Ngayon, makikita mo hindi na 8 hours ang mga nurses natin sa hospital. Ang iba sa kanila ay 12 hours. Yan na po yung minsan kalakaran, hanggang 16 hours. Pero hindi lang po yan sa ospital or sa public health. Kahit halimbawa sa teaching, ang ating mga nurses ay nasa mga teaching universities and colleges, nagpe-prepare ng ating mga future nurses. Alam po ba natin na kulang din ang ating mga nurses na nasa teaching jobs? No? May gusto akong ibigay na isang halimbawa na isang member namin na tapos po siya ng 2 masteral degree at may doctoral degree. Ang hinahawakan po niyang estudyante ay mayroong level 1 na 82 students, meron pong level 3 sa clinical duty na 84 patients, meron pa po siyang level 4 na teaching skills 54 students. So total of about 220 students ang kanyang hinahawakan, ang workload ng isang nurse na ito. Pero ang tawag po sa kanya instructor 1. At ang kanyang salary po ay salary grade 12. Nasa 27,000 lamang po mahigit ang kanyang sinasahod. No? So tingnan po natin yan kasi kahit po sa ibang universities, ito na po yung reklamo nila kasi ang daming estudyante, kulang po tayo sa magtuturo. DepEd po naman na school nurses natin, nagsisimula po sa sweldo na nurse 2. Pero yun na po yun. Hanggang sa mag-retire sila, nurse 2 po yun. So, hindi na po siya na nabibigyan ng pagkakataon na ma-promote at mataasan yung sweldo. At marami pang ibang bagay. Kaya mahalaga po itong security of tenure at saka ito pong salaries na agaran nating mabigyan ng pansin. No? Ikatlo po, yung tungkol sa
Ma'am?
benefits.
Ma'am, sandali, no? Kasi po, I have more resource persons and I have a meeting shed at 3:30. So I have a copy naman po of your position paper. I
Yes
just
po.
want to, if you want to summarize, well, kasi, nag-extend na po tayo because unlike last time,
Yes
I
po.
really have to finish the resource persons I have left today. So kindly wrap up na po.
Yes, Madam Chair. Dalawang points na lang po. Yung pangatlo po ay tungkol po sa benefits. Nabanggit po kasi nung March 27 at kahit kanina ng ibang resource speaker, yung Magna Carta of Public Health Workers na dapat ma-review. Pero kami po ay nananawagan na sana po ay bigyan din natin ng pansin ang paggawa ng batas para sa Magna Carta of Private Health Workers. So meron po kami, Madam Chair, na nabuo sa tulong ng ating mga union sa private hospital. At panghuli po, ay nais po sana namin na taasan ang budget pangkalusugan upang sa ganun po ay mabigyan natin ng sapat na budget yung pangangailangan natin sa mga nursing personnel, hospital man or public health. So yun lang po, Madam Chair. Thank you very much po.
Thank you. Ma'am, I assure you on my watch for the last 3 years, pataas ho ng pataas ang budget ng health. And hindi lang sa kung saan-saan, but my team and I have really exerted a lot of efforts to put the funding where it will have the biggest impact. We worked very closely with DOH and the different groups. So you can rest assured na talagang hinihimay natin yan. No? And we know that the nurses are a big component of our successful health delivery system. So thank you very much, ma'am. And this won't be the last time kasi like I said, I want to have more fruitful discussions. We will break down into small groups itong mga katulad niyo po who are willing to work with us to help find solutions. Maraming salamat, ma'am.
Salamat po.
So our next resource person is Dr. Mirabel. It's your turn. And then after, please be ready, Neda, Dole, TFA. Parang ang dami naman to. Parang hindi ko yata to kakayanin. Observers na pala yung iba. Nashock ako kasi may meeting ako sa chat in 20 minutes.
Very briefly lang po ito, ma'am.
Go ahead, ma'am.
Buenas tardes, Senator Pia Cayetano. I'm very happy to be here. And also, buenas tardes to everyone.
This mo naman yung background kung ba't Buenos Aires ang banggit mo sa kanila. Baka akala na tayong tatlo lang ni Yusek kasi ayan naman dating congen sa Barcelona yan. Kayo naman po from Zamboanga City and dating president ng State United siya. So yun ang reason kung ba't nagbabatian kami ng Buenos Aires. Papaturo po ako sa kanya sa Bacano. Tinetext ko pa. Paano ba to? Kasi marunong ako mag-Bisaya, marunong ako mag-Spanish. So pinagdidikit-dikit ko na lang lahat yun.
You see. So, thank you very much. Ito po, ang dami-daming challenges as far as nursing is concerned, di ba? Nursing and nurses talaga nakakahilo yung mga storya na yun. But anyway, I just like to present very briefly in 3 slides what initiatives we are taking to address the current situation. So, syempre kami ma'am, because our concern is sa curriculum po, I'd just like to make a declaration na wala pa tayong bagong curriculum po.
But in the news, can you clearly state,
Yes.
in the news it was reported na CHED is looking into?
Yes, ma'am.
Okay.
So there are 2 things. We still, CMO number 15 series of 2017 is still in place. However, the proposed program that we are trying now to come up with to be relevant with the time. And this has to go through consultations sa ating internal and external stakeholders. Ito po yung pinisent in the other day. But we are trying to look into this because this might now take multi-sectoral consultations. However, we'd like to say that this curriculum proposed BSN curriculum starts with or kicks off with exit credentials. Okay, so this covers first year up to 4th year pa rin. Kasi ang end product talaga, ang curriculum talaga natin is only one, BSN, Bachelor of Science in Nursing. Yung po ang
Yes.
emphasis natin.
Can I your one slide is very clear.
Yes po.
So if I may state it as I understand it, no? may exit program, the end result is a bachelor's degree in nursing.
Yes.
And may exit program ka after first year, it's a certificate, and after the second or third year, something like that, a diploma. In a nutshell.
In a nutshell.
Okay. The reason I'm cutting to the chase is because this is very, very important to me. Why? Pag nanonood ako ng mga pelikula or mga sitcom or whatever man ng US, naalala mo yun, they call it, and my mom was once, candy stripper ba yung tawag nila doon? Yung parang nurse aide ka sa hospital sa Amerika, na parang you're an assistant, di ba? They're high school. They're high school. Tapos, babanggitin ko na naman ang aking minamahal na majority floor leader, Joel Villanueva, champion naman namin sa TESDA, sa Tech Book Training. Kung yun na high school, nakakatulong na doon. What more kung nag-specialized program ka in Tech Book, di ba? So, aligned yung na-visualize ko dun sa sinasabi nyo. And it is consistent also with our ladderized education law, which the late Senator Angara, the father of our chairman of the Committee on Finance, pioneered, and I was the one who passed that law in 2015, 2016, around that time. Tama? So, parang ladderized to. Pwede ka na mag-exit ng first year, pwede ka magtrabaho because the purpose of, I will interpret it the way I understand it, and you are free to tell me iba naman yung gusto nyo, fine. I'm just telling you this is how I interpret what you are showing me. After first year, and or second year, third year, that's a ladderized program. You can exit, you can work because kailangan mo maghanap buhay or for whatever reason, na-bored ka. My mom, by the way, was a preschool teacher, started with nursing. And she decided somewhere along the way, I think first year, second year pa lang, na hindi niya gusto. So, ganun din yun, di ba? Pwede ka mag-exit ng first year, pwede ka mag-exit ng second year, but you will have some kind of recognition for what you finished. And you will be able to work gainfully, correct? Yan ang intindi ko. And then you can go up to fourth year, and if I would like to be able to continue that, you can even recreate this program with all the other sciences and the other allied health professions. So you could do that for therapies, right? So like there are so many, I can only speak from experience. I am an athlete, and up to this day, I have a battery of professionals that help me maintain my desire to be healthy and fit and also to be competitive. So I have a sports conditioning coach, I have a strength training coach, I have a massage therapist, I have wala naman akong sports psychologist. I wish I did, but I don't. So I have this battery of, and then I have an orthopedic doctor, I have a musculoskeletal specialist, lahat yan natatawagan ko physical therapist. Kasi nga, that is the whole, di ba, the whole range of professions that can help an athlete, and so on and so forth in all the professions. So you can actually replicate this, correct? In other professions. If you wanted to, you could.
Yes, ma'am. What is our really basic concern is really look into the competencies. Because we would like to really ensure the safety and general welfare of our clients.
Babalikan kita dun sa sinabi ko. Kung yung high school student nakakapag-assist in some way, di ba? Kung kaya nilang alalayan yung na-stroke, kailangan pa bang nurse na may bachelor's degree ang aalalay or PT ang aalalay magsusundo? Hindi, di ba? Hindi naman yun ang kailangan sumundo dun sa room para dalhin sa PT room para alalayan. Ang magtuturo is the PT. Pero di ba lahat naman yan pwedeng may assistant? Yun lang naman ang sa akin. Let's not take forever. Kasi it's so tiring eh. It's so tiring for the Filipino people to wait for us to make decisions.
That's precisely, ma'am, why I'll go to the last of my slide.
Ano timeline nito? 3 months.
And tomorrow, ma'am, kasi tomorrow we have a meeting. Tomorrow we have a meeting.
Ang galing ng sagot, usually tumatawag ng mas mahaba. Ikaw in 3 months, ginawa mo.
Kasi ma'am, tomorrow we have a meeting, and this is one of the issues that we will be talking about. But I'd like to emphasize that CHED will sit with industry and facilitate memorandum of agreements in between the industry and HEI to directly hire graduates to their healthcare institutions, specifically nursing degree with exit credentials. And the second and the foremost is partnership with TESDA to map out skills and competencies to provide greater access to students and explore possible career pathways through the Philippine Credit Transfer System. So, credit transfer system. Yun lang po ang aming sharing for today because there will be consultations yet to take place po.
I understand, but what I want you to, again, using the words of Yusek De Vega, paradigm shift. I understand you have a job to do. I understand you want to ensure that they are competent for whatever title we give them or to perform those tasks. But meanwhile, ang kapalit nun is wala. Wala. Walang gumagawa. That's where we are. So we need to be innovative. We need to be able to take risk, reasonable risk to make these changes. Kasi in the meantime, wala. Yun ang kapalit.
That's precisely, Chair Popo is really looking into this to ensure that we take action and come up with innovative program.
And one other intervention that I have is what do we do with the nurses who are not board passers but would like to practice? What do we do? We know that there are nurses who graduated and are or are not board passers in other professions. Choice naman nila yon. Again, I feel it's the burden of government or maybe government direction, but also the private sector to give them their opportunity to work in the field that they chose. But what about those who did not pass? Kaya mabalik ko yan sa inyo, pagka binuksan nyo ulit yung mga schools, ako, sisiguraduhin ko, pumayag kayo ng schools na may track record na kaya magpapasa. Huwag dinanakaw lang natin yung hard-earned money ng mga parents na papabayaan yung pumasok dun sa eskwelahan na, ano na, yung percentage ng passing nila, mahiya naman sila.
Yes, ma'am. But relevant to what you have just stated, that's precisely why, along with this slide, the previous slide before this, we talk about upskilling and reskilling our nurses. Kasi nga, we talk about the repeaters, we talk about those who are not practicing the profession, and we'd like to have partnerships with industry and hospitals for more exposure to clinical areas, community immersion. We'd like also to do update and retooling of the BSN program, offer other job roles for underboard nursing graduates, and then involvement of industry partners and providing incentives and financial support to deserving nursing graduates who pass the nursing licensure examination. So actually, ma'am, yung upskilling and reskilling really is part of our strategies or approaches to help to address the current issue.
Oh, pero
Thank you po.
let's not be, let's talk about what is difficult to talk about. In the first place, may mga eskwelahan dyan na hindi magaling magturo at tumanggap sila ng mga estudyante but that may not really have the aptitude for that course. And then, kinuha nila yung pera ng mga magulang, pinaasa nila na hindi naman pala nila kayang turuan. Like ako, sabi mo kahit magbuhos ng pera yung magulang ko para maging doktor, baka masayang ko yung pera ng magulang ko dahil hindi ko pala aptitude yun, di ba? So, yun lang, yun yung reality dun eh. And huwag na natin dagdagan yung sakit ng ulo na ganun ang nangyayari. Kasi not only is it a painful experience not to pass the board, I would think, di ba, naawa ka sa sarili mo dahil di ka pumasa, awa ka sa magulang mo, nahihiya ka. But let's not perpetuate that, di ba? Kasi magre-retool ka, magre-reskill ka in the first place, but kailangan gawin mo. It's a different thing when we talk about adapting to new technology or new skills that are required by
Yes.
the 21st century.
Yes.
Pa yun, ha?
Yeah.
Maingat ako na pag nakuko tayo, hindi ko sinasabing huwag kayong mag-o-offer ng ganong programs. Kailangan yun. Pero in the first place na, bakit ba dyan siya napunta sa course na yan na hindi talaga yan ang aptitude?
Yes
Hindi
po.
naman talaga. Okay?
So we will really ensure that all of these, ma'am, are noted and we will be putting this as one of the items for discussion tomorrow.
At saka yung papayagan nyo ng nursing school, tingnan nyo naman muna kung meron siyang mga courses na napapapasa siya. Kasi kung wala siya napapapasa na nursing na ibang courses, okay na siyang payagan magbukas. Kawawa yung tao. Tapos lahat, I don't know the percentage, but how much of that is government funding also? Because ang lawak-lawak na ng ating mga scholarship programs.
Along that line, ma'am, meron din po tayong strict guidelines for approving the opening of
Nursing school.
Nursing
O,
school.
patingin nun, ha?
Yes, ma'am. Let's share it with you.
Thank you.
Yes, ma'am.
Muchas gracias.
Muchas gracias ulit, otra vez.
Okay, let's move on. Ano ba? Guys, patapos na itong mga iba. Ito, di ba? Alas, di ba siya? Okay, so we have NEDA, DOLE, and DFA to speak. So sa NEDA, Director Girly Grace Casimiro Igtiben from Social Development Staff.
Thank you, Senator T and Dr. So we're just going to share the possible economic impact. It was requested to us and the
Yes.
status of the National HRH Master
Yes.
Plan and the possible strategies, which I think is very aligned with what the Ched was proposing. First, on the possible impact of HRH shortages, we identified initially four possible impact. One is increased healthcare costs because with the shortage of healthcare workers, it will prompt higher investments from healthcare organizations to cover higher remuneration to attract and retain workers. So this may lead to higher out-of-pocket healthcare costs for patients and higher insurance premiums from employers and governments because it will be passed on.
Less access to
Yes,
those who
less
cannot afford.
Yes, like the senator. And then second is there will be reduced productivity and reduced access to healthcare because with healthcare worker shortages, this can lead increased workloads to the existing staffs, which can reduce their productivity and increase the risk of burnout and turnover.
And that's already what was being discussed by our representative from Philippines,
Yes,
from Filipino Nurses United.
Yes,
Yeah,
ma'am.
yeah.
And
It's already being experienced, burnout, too many patients to take care of.
yes, Senator, and it will lead to a negative impact on the quality of care
course.
that our patients are.
Which again is also reflected by our shorter lifespan, di ba? The higher maternity mortality rate and infant mortality. So we're already seeing it actually.
Yes, Senator. And then the negative impact on economic growth, of course, because we know that healthcare is a major source of employment and economic activity in the country. So with these shortages, it would really have an impact on that. And then last is increased burden on our caregivers because without sufficient healthcare workers, the burden will be transferred to the family members. And we know that it is also a gender issue because females in the family predominantly will be given that function of taking care or of the patients in the family. And then in terms of the status of the HRH Master Plan 2020-2040, this was already approved by the NEDA Board Social Development Committee cabinet level. So it was approved already last June 2022 last year. There are already projections that were done by DOH NEDA with the support of the Asian Development Bank. In terms of the total HRH gap, this only includes, next slide. This only includes the barangay health worker, barangay nutrition scholar, registered nurse, midwife, medical technologists, physicians for government and private sector. So we are seeing that in 2020 to 2040, we will be needing around 2,630,917 HRH. With this administration, we will be needing 1,163,192 HRH. And then for the total HRH gap, the government side will be needing 860,774 in total. And then for this administration, it's around 412,062. That's for the government. For the private sector, we'll be needing a higher HRH. That's 1,770,204. And for the Marco of this administration, 751,230. It would require total budget requirement. For until 2040, from 2020, we'll be needing around 12.1 trillion pesos. And for this administration, we'll be needing around 2.45 trillion. This will cover the trainings and the salary, the remuneration of the HRH. And then on the possible strategies to address the HRH shortage, we're happy to note the Ched's presentation a while ago because our first recommendation really is to implement a step-up ladder for the health curriculum. We are seeing already this in the UP Manila. They are doing it. They have the senior high school certificate for community health work. So they already have that. And then UP Manila also.
UP Manila. So
Yes.
UP Manila is administering a senior high program
Yes, based on our
directly with them,
community health.
directly with them, or parang may senior high silang
They have
outfit.
it's directly with them.
So nasa senior, so sila mismo.
Yes po.
I'm very happy to hear that. So that can be done ano, Milabel,
Baka po
the
the
other,
chair can look at it.
Oo, kasi, ano ko lang ha, sorry.
It's the demo hindi the senior high.
Yes,
Yes.
kasi banggitin ko lang na even before the pandemic, example lang, nag-tie up ang isang tech company sa Taguig. Tapos parang gusto nga nila grade 10 yata kasi parang 3-year program yata sila eh. Nothing to do with health, it's a tech company. Pero grade 10 to so more beyond grade 11 and 12 sila eh. They wanted na senior high plus 2 years in college. So but I recall nga parang beyond mga senior high, so baka grade 9 or grade 10 pa lang, alaga nila. And if you look at the programs in Europe, which I'm sure you have your people who are doing that, apprenticeship is more effective. I read very recently in, I think it's the World Economic Forum or Harvard Business Review, apprenticeship is more effective than schooling. Kasi nga, on the job ka and it's more interesting, yung retention. So, it's really, diba, again, paradigm shift. Pero kailan pa? In our generation naman, or in our term of office? Sige, ma'am, go ahead.
Yes, Senator. So that we wanted to that's very supportive. The NED is very supportive with that curriculum of the CHED. And then we just wanted to to emphasize yung although we have this ladderized kasi the nagiging problem, especially with the mga K-12 natin, they are not being hired. So we wanted sana na to have it also advocated na merong ladderized program so that the industries will be able to they know that they need to hire these student kahit may certificate and diploma sila appropriate to their skills. Kasi,
Especially naman if kunyari dito, isa ng UP Manila, sino ba naman walang respeto sa UP Manila? And then in the SUC, pioneer it in SUCs na known naman sa region na naman talaga nila. In that, wag naman yung, well, syempre minsan mas innovative yung maliliit. Pero I don't care kung maliit siya or malaki, pero may track record naman siya in whatever area they're trying to push para madali mo namang yan dun sa iba, di ba?
thank you, yes, Senator. And then second, we support the Senator's suggestion on apprenticeship because we wanted an internship program with appropriate benefits. Kasi parang we can start with second year or third year, then on-the-job training na sila sa hospitals, either private or public. And then we give them a little bit allowance. Siguro kasi it's a work that they will also be doing. So both that there's an experience that will be developed. And
Can you give me numbers next time or just give to my staff? What is the economic cost to us of not doing this? Kasi that's the only way you can tell people na we need to pull out funding for this type of programs, right? That's what I want. So, ano yung economic cost? O, di yun nga, yung shorter lives, di ba? Yung they will pull out of the job market earlier because nagkakasakit. We want to see that. Si Dr. Tony Dance, yung grupo niya na Action for Economic Reform, they always do the numbers for visa tax. So, you can contact them if you want them to help also.
Sige pa, Senator, we will get in touch with them so we can work together on the numbers. And then third, of course, what was said by the other resource persons on improving the conditions and job satisfaction. So finally, giving them a career path in this industry para hindi talaga sila aalis kasi alam nila they have a future in our industry. Like from nursing aid, they can be a nurse and then go up the ladder if still they want to pursue higher education and become a doctor, for instance, and then scholarships are provided. Fourth is the increased use of technology, telemedicine, innovation, because it will lessen the burden of the HRH, but especially the nurses. The other countries are already using robotics. Yung minsan po, center yung pagbuhat ng patient. That's malaking malaking tulong sa ating mga nurses kasi according to some nurses that nagbibigay ng anecdote is that kung mas madali naman yung trabaho and you have smaller compensation, they will still choose yung hindi naman yung higher pay because mas less naman yung effort for them. So it would be good to pursue new technologies and innovations in terms of our industry. And then fifth, improve, of course, increase funding for education training programs. We support the reskilling and retooling of especially of the current nurses, lalo if there is a new technology and new innovation that we will be introducing. And then we need to really build planning capacity to develop.
In terms of new technologies, I think naman DOH, well actually, di ba job niya yun? The HTAC, Health Technology Assessment, na ano ba yung technology na essential na ma-introduce for cost saving and life saving? Kasi marami naman technology for convenience lang, which is great if you can afford it, di ba? So, di ba job nga talaga ni HTAC yan to help us determine? Kasi this is the second or the third time in the hearing na binabanggit yan, di ba, na investments in new technologies. Pero ano, that's crucial. Diyan tayo magtatalo and job talaga ni HTAC yun. So, balik tayo dyan sa, let's already use the resources that we already have in place. And by law, sa universal healthcare, job yan ni HTAC.
Yes, Senator. And then building capacities to develop or improve HRH policies and strategies, strengthen data mechanisms. Siguro po, it's important to have forecasting and futures. Ito po yung ating committee. Futures thinking because for instance, some years back, tayo moratorium tayo on mga nursing courses. Siguro
But that was also, sorry if I may, Dr. Milabel, di ba tama naman na ang short explanation ko for that is number one, the hiring at that time, I think baka up to now per region is cyclical, right? So, excuse me, magbaban sila ng hiring sa US ngayon, tapos mamaya in 5-10 years, open na naman. That's one. So yung mag-enroll pa lang ngayon, di niya alam na by the time na mag-graduate ka, wala na nag-hire sa kanila. And then number two, there really were naman an influx of schools na substandard talaga. So for me, I'm just very careful when I say tigil na yung ban, ganito, because there's always reasons, diba? But always regulated. I think that's a better term, diba? To regulate and be very to be in touch with the changing circumstances so that yung regulation is proper.
Yes po, Senator. And let's improve our yung data capacities natin so we will be able to forecast and futures thinking in terms of the needs of the industry. Thank you po, Senator. That's all.
Thank
for
you
now.
very much. Thank you. So let's move on, no, sa DOLE, si Ms. Jean Orsolino from the Department Legislative License Specialist.
Good afternoon, Madam Senator, Madam Chair. Good afternoon to my colleagues in the government and all the guests. On behalf of the DOLE team present online, am I heard, ma'am?
Yes, we can hear you.
Yes, ma'am. I will proceed. May I share the insights coming from one of our bureaus and so far as recommendations on the Senate resolution is concerned. One, we would like to recommend the institutionalization of human resources for health network and its HRS master plan as shared by NEDA to harmonize policy directions and coordinate the actions of its members to ultimately attain quality health care for Filipinos. Second, the improvement of remuneration of our HCWs or our healthcare workers through legislation or through the amendments of RA 6727 or the Wage Rationalization Act. However, it is our opinion that beyond the mandated benefits of the Labor Code of the Philippines, we would like to suggest that we consult our tripartite plus partners to arrive at a win-win solution. Any adjustment in the salaries of healthcare workers will also have an effect in the salaries of other actors in the healthcare industry, which will eventually result in an increased cost of healthcare services in the country. Third, the provision for participation in collective bargaining or the full enjoyment of freedom of association, as well as their access to basic social protection. And last but not the least, the alignment of the provisions of the proposed law on the ratified ILO Convention number 149 or the Nursing Personnel Convention. Madam Chair, if there are questions relating to wages, working conditions, and employment, I have my colleagues with me online. Thank you po, Madam Chair.
Sige, I'm not sure, no, but I hope your colleagues and your colleagues in DOLE have been monitoring our hearing. But I assured everyone that our goal is to ensure not just decent working conditions, but conditions where our health workers can thrive, not just for the nurses, but for the others. So parang for me, given na yun I will always listen to it because clearly we have not really achieved those decent work conditions that we are aspiring for them. But in addition to that, we are also looking at the impact of their departure, the wholesale departure and recruitment from other countries, which is affecting us. Siyempre, it's a given na para ma-retain natin sila, gusto natin talagang decent nga yung working conditions natin. So thank you for helping us ensure that, and kindly remind your team na we appreciate that they remain proactive and work with DOH on this kasi the more input we have, it's easier and better. Like, kumbaga kung makikita natin yung best practices na, parang lahat naman have limitations sa resources. Pero sino ba yung mga ospital? Sino ba yung mga LGU na may best practices? Gusto natin makita yon, di ba? Sino yung mga na-visit nyo na may mga, nasa best practice list nyo and nasa worst practice list nyo. Magandang makita yun, hindi para may pahiyain tayo, pero para talagang makita natin kung bakit yung iba nagagawa. Ano yung meron na nagagawa nila at ano ba yung wala. Kasi at the end of the day, if you ask me, boils down to political will. Diba? Yung desire to achieve that, the importance to the health workers to recognize na without them, hindi rin naman mabubuo yung delivery of health system natin. So maraming salamat, ma'am. And
Yes, Madam Chair. Salamat po.
finally, I just want to check if my classmate, Yusek Ed De Vega, has anything more to add.
No, yes, bueno, gracias por vuestra dedicación y todo el trabajo que usted está haciendo. No, your dedication. We'd like to thank you because you showed some courage, because the hard decisions, including banning on direct employment, we can't do that at executive department level. No, it's one thing we want to show you now. Kami sa DFA, whenever they say we want to network, we want to get workers, that's not. We already had that paradigm shift, that particular one, that we're not promoting deployment.
Yes.
No?
Yes.
In fact, lalo na kung nurses, kasi because of the health sector issues, concerns. In fact, right now, we were supposed to, the DMW was hoping to sign as soon as possible something with the Austrians on the health sector, but we in the DFA pinareno muna namin because let's see muna other concerns. You can raise it also with Secretary of when you talk to her now. They will eventually sign something this year, pero there are more considerations to
And
make.
what what I hope this hearing achieves is bringing to the highest level sa mga principals nyo, sa secretaries nyo na, because I wouldn't be aware kung what kind of discussions you're having sa DFA. I also don't know what discussions you're having in DMW. But now you know that it matters to me, to us, to everybody present here, yung welfare ng Filipinos as far as their health is concerned, including, alam ko na hindi ko na kailangan sabihin sa inyo, alagaan nyo yung mga nandun na. Pero yun nga, sabi mo nga, okay, it's a policy, we are not promoting. But beyond that, nasasama ba to sa usapan? Nasa checklist ba yan pag umalis ang presidente natin na nasasabihan siya ng mga principal yun na, boss, ito po yung kumukuha ng lahat ng mga health workers natin. Tapos, okay naman sila mag-sweldo, so okay naman yung health workers natin. Pero in the meantime, wala nang naiwan dun sa barangay ng ganito, sa munisipyo ng ganito, dahil kinuha na nila lahat. That has to be discussed. And one of the stories that I share is that when I was president of the Women's Bureau of the Interparliamentary Union, I shared a 2 or 3 day session on migrant workers in the National Assembly of France. No? Sila yung nag-host sa amin, and puro European countries to. And so they were all explaining ko, kasi European countries naman yun eh. So mayabang sila, kinikwento nila kung anong pag-aalaga nila ng mga overseas workers natin, yung migrant workers. Proud sila na, kasi yung mga nag-attend doon, syempre, mga parliamentarians yan who are active na sa welfare ng ano. So, pagyayabang nila, ito ginagawa namin. So, at the end, kasi nga ako yung nag-chair, I gave a little presentation. Sabi ko, thank you for taking care of them. In the meantime, ganito kami sa Pilipinas. Wala na kaming doktor dito, nurse na lang ang naiwan. Yung mga pamilya dito, wala nang nanay dahil nandito na sa inyo lahat. Then lahat sila, tapos I asked them, have you signed? Are you a signatory to the, I always forget the exact title, migration, welfare, the welfare. There's a, look it up na lang, I just recently gave a speech, okay ulit, the UN Convention on the Rights of Migrant Workers. Yon. And lahat sila, kasi hindi talaga sila signatory. Di ba? Dami pa nilang sinabi, pero their country doesn't even bother. They don't even know. And these were parliamentarians who are proudly fronting as the protectors of migrant workers' rights. And they didn't even know about it. Now, this is admittedly circa 2009, 2010. That was the time I was president. When I looked at the list, nadadagdagan naman. But mostly, yung mga recipients ng ating migrant workers, hindi pa rin sila pumirma. So parang tayo lang ang pumipirma niyan. So parang this should always be included now. My brother, Alan, has been the Secretary of Foreign Affairs. And granted, you have a few minutes to talk to your your counterpart, di ba? So pipiliin mo talaga kung ano yung three top mo. Also guys, it's everybody's job here. Make sure it's on the top 3 of your principal. Di ba? Kasi kung ang iba, ang resources nila ginto or oil, ano ba resources natin? We always say tao, pero wala naman sa top 3 natin parati. Okay? So, yun. Anyway, I interrupted because you made a very valid point, and you have the floor again.
Yes, lastly, we took a lot from our fellow panelists here. They're very impressive. They remind me of you now. And we're proud to be working together for our healthcare workers. So we will adopt what we learned today in our future engagements.
And that's what's important naman, no? I do not profess to be an expert. Marami akong natututunan. Sana lahat tayo natututo tayo sa isa't isa. Now, I had asked you, ASEC Alcantara, to intervene kanina. Yun na rin ba yung kabuuan ng mga recommendations mo o may idadagdag ka pa?
In addition to the 6 points, Madam Senator, I believe you also requested us to submit a complete set of the bilateral labor agreements that we entered into in as far as healthcare workers is concerned.
Okay.
Yun pong written na 6 points ko plus the submission of the additional BLAs that were recently signed, isusubmit po na. And that would be it.
But what I want is to also find the best practices. Kasi in my hearings, when I chaired the Committee on Health way back at wala pa mga staff na to, nabanggit na yan nung DOH no, na ano yung mga model countries. And I do recall one of them was Poland. Si Poland daw yung nakakuha. Tama ba?
Yung triple win project sa Germany po.
Oh, yun. Okay. So, in the next meeting, yan ay mga pag-usapan natin, di ba? Na, let's not reinvent the wheel. If receiving countries, receiving countries for, let's use nurses, but it's not just nurses, di ba? Sabi nga sa akin ng ibang colleagues ko, i-extend ko na tong hearing na to beyond health. Sabi ko, okay, but I'd like to start because I like to start with health because we can easily replicate it naman with other, ngayon nga medyo nagiging focus is nurse, but I also try to say na, sandali hindi lang naman nurses, sa iba din naman. Pati sa mga PT, occupational therapists, lahat yan kinukuha din naman sa atin. But going back, these receiving countries, kung sila napapirma na ng ibang bansa, it makes it easier for us to say na we want the same or more because baka mamaya we're even giving more to them than yung nagpapirma, aggressive lang magpapirma yung iba.
Yes po, Madam. Yes po, Madam Chair. We will prepare the benchmarks, best practices.
And then idagdag ko lang kasi just before Holy Week, my last official trip was with our Senate President and our colleagues to Japan. And I also recall na I think it was around 2015 or 2016, so that's a good 7, 8 years ago. I also went to Japan and also met, the same way we did this time, with members of parliament in Japan. So second time ko to have extensive meetings with them. And recognize nila, it's always on the agenda, the aging population of Japan. It's on the agenda. But, and then, di ba, time, JEPEPA, how many years, magta 20 years na yata si JEPEPA, they open up to nurses, but the requirements are quite hard. We support in the sense na, again, freedom lang naman ng mga, ano natin to choose. But on the other hand, again, I'll go back to where I stand. You want to get our resources, which include our very valuable health workers. What do we get in between? Kasi ang feeling nila, salamat kayo, binibigyan namin kayo ng trabaho. We should not negotiate that way. Ang negotiation namin is, pasalamat kayo, kinakausap namin kayo, and may chance kayong kumuha ng health workers namin na napakagaling. Diba? So, yun. Okay, anyway, my staff reminds me, may meeting ako with Chen. So, I will suspend because I'm not sure if the next is a hearing or a TWG, but definitely we will be in touch with all of you. I thank you for all your time, for sharing your insights with us. And I hope and I expect to see most of you again for the next steps. Thank you very much.
Thank you, Madam Chair.